Hi, this is Dr. Brian Baker, the founder of the Spine, Hand, and Foot Clinic in Independence, Missouri. On the last video on low back pain, we kind of took you through the process of understanding what kind of things a chiropractor would not take care of with regard to low back pain, serious issues that really are not mechanical in nature. And then we talked about the fact that symptoms or the cause from the thing that causes you to come into the office, the thing that causes you to usually be concerned is a symptom. But that symptom is the result of a cascade of things. And the farther back in this cascade that we can correct, the more probable that this will reoccur less frequently or not at all. So the first line is just to make you not feel the symptom, which is usually what medicine does. But there are other things that can be done to correct other things in that cascade. One of them could be surgery, which chiropractors don't do. But if there's an injury that requires surgery, surgical correction may be the only thing that corrects that cascade. Okay, so let's try to understand that a little better. Where does the pain come from? That's a big question that a lot of people ask. They want to know, why does this hurt? Well, let's go specifically through it. I hope you've got some patience, because you have to understand there's only two types of things really that can cause the sensation of pain. One of them is when what's called a chemoreceptor gets stimulated. In other words, some chemical in the tissue sets off a receptor that sends a message up to your brain, and you feel pain, because you really don't feel pain in your back. You feel it in your head. The message has to get up to your head from your back in order for you to feel pain, because if the message doesn't get up there, you don't notice any pain. Okay, so one of the types of receptors that can stimulate or be stimulated and cause pain perception in the brain is chemoreceptors, usually the result of inflammation. Okay, that's why anti-inflammatories generally work pretty well in reducing pain. Is because they reduce the inflammation in the area. If the inflammation is the thing that's stimulating the pain receptor, then the pain goes away. Doesn't necessarily mean the problem's resolved, it just means your pain has gone away. The other kind of pain receptor is called a mechanical pain receptor. In other words, it's a receptor that stimulates the pain sensation in the brain if there's compression or traction, stretching and pulling, or pressure. Okay? So if something is out of place, if it's compressing, if things degenerate and begin to squash that area, if you bend over and pick something up and pull an area too much, those are the things that could stimulate mechanical pain receptors. Okay? So inflammation is usually the cause of the stimulation of chemical receptors that stimulate pain. Compression or stretching is usually the cause of mechanical receptors stimulating pain sensation. Okay, so we've taken one step up in the cascade. Now we know that pain is being felt, and we know that the stimulation of one of two types or both of pain receptors is causing the sensation of pain. Now, in the next video, we'll take the next step up and look at some of the things that can cause those pain receptors to be stimulated. Because again, the further up we go in this stair step of cascade, the more probable we can give you a long-term correction of your low back pain, or at least keep it manageable and better under control. Okay, see you on the next video.